Hey guys! So you probably are watching this video because you found me through TikTok, but if not, for context, last week I posted about how I got transmasculine top surgery 6 months ago with Dr. Jonathan Keith at East Coast Advanced Plastic Surgery in Livingston, New Jersey. So I'm doing this video to just expand on that, since obviously TikTok only lets me talk for like a minute and I can't get all my information out at once, but yeah, also for just a little context about me, currently my name is still Sarah, because, government name, but I clearly don't look and definitely don't feel like a Sarah anymore, but for the time being, hi, welcome all, I am Sarah. I go by they, them pronouns, and I identify as transmasculine, non-binary. So yeah, that's me, but more importantly, back to what I was talking about, Dr. Jonathan Keith. So I'm gonna link in the description part of this video resources to the website of his practice, and then also just an article talking about his whole history with his qualifications, where he went to school, all of his different accomplishments and stuff like that, since this is not paid rep, so I'm obviously not gonna tell all of his shit because he has his own stuff online, but I want to talk mostly just about my experience with the consultations and everything leading up to the surgery and the aftercare, just as a personal testimony for what my individual experience was with him. Because while I personally found him to be a very, very informative, compassionate, intelligent surgeon that I fully felt safe and trusted with, that's not to say that everyone's experience was or will be the same with him, and I also don't know his full character or what he's like outside a professional sense, so nothing that I say is absolute knowledge on him, just my perspective of how my surgery went. And I guess basically a year and a half ago is when I seriously was pursuing top surgery. It was definitely something I knew I wanted, since I was 10 years old, 12, sad preteen years, trauma. Anyway, but yeah, so actually in my adulthood, I'm 22 by the way, almost 2 years ago, I was getting to a point where I was comfortable and out enough about my need for medical transition, and I was seriously looking into it. But as many of you might know, trying to find an actual top surgeon with actual training in transgender specific gender affirmation surgeries in New Jersey or any other state really is very complicated and very draining. But I got lucky that I was in a support group at my university that I went to, and someone in there had also gotten a surgery with him, so they recommended him, and I was able to research him. But prior to that, I was having no luck, and I was almost considering someone in Pennsylvania, but they weren't taking my insurance because I still have Medicaid, because I'm poor. But, sorry. So Dr. Keith, one of the biggest things was that at the time he wasn't working at East Coast Advanced Plastic Surgery. He was working at the Rutgers Center for Transgender Health, which he actually was the founder of, sorry, my mind's all over the place, but so talking about his credentials for a moment, I know on my TikTok I said he basically got into surgeries to help transgender people, which that's technically a bit of a stretch. That's obviously not his whole deal. He does non-transgender surgeries as well and all that, but his his advisor and mentor when he was in medical school was one of the leading people on the East Coast as far as researching and performing gender affirmation surgeries. So that really kickstarted his introduction into that area of surgeon shit and all that. So then he became the founder of the Rutgers Center for Transgender Health, which was the first real big transgender health center in New Jersey. And fun fact, he's also the first surgeon in New Jersey to have performed female to male phalloplasty surgery, so pretty cool there. But And he also has a lot of different published research on like different techniques for transmasculine top surgery and all of that. So while he is not limited to just transgender related surgeries, he does specifically specialize in it, has spent years researching, studied under someone who, oh my God, Shelby, say hi. Shelby, come back. Anyway, yeah, so he's not just some random surgeon that's maybe done like one top surgery with botched results. He's done hundreds of surgeries so far, and from my awareness and research, he is honestly probably the best surgeon in New Jersey, potentially the East Coast, for these kind of surgeries. But I'm going to link in the video all the different resources for him. There's an article I have saved about his different credentials and all that stuff, and then also just a link to the practice that he's at currently, his website. But yeah, I'm jumping everywhere. Sorry if I repeat myself. But yeah, so then when I had my first consult with him over a year ago, he was still at the Rutgers Center for Transgender Health, and I literally scheduling for surgery, and then all of a sudden he left the center, and which actually was a blessing in disguise. Even though at the time I was very upset because I was like, fuck, well, now my surgery is delayed. But he decided to start working at the East Coast Advanced Plastic Surgery place because he felt like he was a little bit restricted at the Rutgers Center. And now at the practice that he's at currently, he's able to take on any patient base with any insurance, because so how he works it out is that he doesn't have a specific agreements with any type of insurance like he did previously at the Transgender Health Center, or just how doctors in general usually have a certain amount of networked insurances. So his approach is everything is out of network. So he is willing to work with people from out-of-state insurances, with people with like Medicaid like I had, or in-state insurances, or even out-of-pocket. The main thing that you would need to know is for your personal insurance, like what is your out-of-network plan? Because not all insurances do allow for out-of-network coverage, so that's going to be the main barrier, because his approach is he wanted to make sure that he can work with anyone. He didn't like being restricted at the last place of like what type of insurances he was allowed to try and work with. So yeah, with your insurance, if you are trying to consider Dr. Keith, I think your best bet is to research what is your out-of-network plans, and like what would be your copay and different stuff like that. But yeah, so he's really willing to work with insurance as far as what he's explained to me. And also, I have ADHD and I am losing my mind trying to remember to say all the different points that I was trying to remember to say. Oh, also, I don't know if I mentioned, he is a member of the World Professional Association of Transgender Health too, so just another little credential to indicate that he really is a comprehensive surgeon for gender affirmation surgeries. And also, I don't know if I mentioned, it's not just for transmasculine, he does transfeminine surgeries as well. My partner, she's actually planning to have top surgery with him this fall, if all goes accordingly. But yeah, so I think one of the really big things after I was able, or backtracking, after I was seeing him at the Rutgers Health Center, and then he transferred over to the other place, which this place in Livingston is so freaking fancy. Like there's like crystal chandeliers and stuff everywhere, and it's just cute and very nice. Very much an upgrade from the other place. But sorry, that is the kitty litter robot going off in the background. So bear with me as it buzzes, because I don't want to re-record or edit this. But yeah, so one of the biggest things that was for me with there is that it's not just him who is aware of transgender health and transgender identities, because he has the whole staff trained to be respectful and mindful of that. Like, everyone in the office, like, I only had one problem of misgendering, and that was someone who was filling in that I don't even think worked there. But, like, when you're gonna call, like, saying you're going to, but if you call his place, they always ask, like, what is your government name, what is your preferred name, what are your pronouns, and be respectful of that. And Dr. Keith himself is very understanding. Like, never at any point did he misgender me or do any of, like, the typical shit that other doctors constantly do to gender nonconforming and transgender people. But yeah, so I just felt like my whole time with him was so much active respect, because not that it's everyone's experience, but my experience, a lot of doctors have been very, very rude and against me getting the surgery, and just honestly transphobic, like, say what it is. But with Dr. Keith, like, it was just so refreshing to have the respect. He fully explains everything that goes on. He's very in-depth to make sure, like, you understand everything involved and everything, that your options, the pros and cons to the surgeries, his success rates, before and after photos. And specifically with me, which was really refreshing, since I identify as non-binary, I'm not exactly, like, aligned with cis malehood or, like, full transition type of stuff. So, like, since non-binary people, not all, but some, have different goals with their chest reconstructive surgery that might not fit the exact definition of male to female top surgery, which I know, like, the language is all weird and different stuff like that. So, like, I don't mean offense, by the way, that I'm wording anything, so sorry if it does at all in advance. But, like, for me, I personally was a bit insecure about male nipple placement. Like, for most male nipple placements when they do the surgery are a little more off to the side, versus female is typically a bit more centered. So for me, to make sure that my concern about nipple placement was met, he put my nipple in between the two locations. And each time, every consultation and the day of the surgery, multiple times, made sure that I had direct, like, control and approval of where the alignment was and all of that. And he even talked with me about, like, you don't even have to get rid of everything if you don't want to. You could just do a reduction, or even stuff like, I don't even have to have nipples at all, because he's done some transgender, non-binary top surgeries where people have just been like, no, I don't even want nipples. But yeah, so I basically went to 2 consultations, one at the Rutgers Center, one at the new place, and then a pre-surgery meetup one, and then a surgery one, and then I've met for 2 post-surgery checkups. And each time I just feel like he never rushed me, and he's very actively engaged in your care and seems sincere that he wants the best for you and your experience. And I just personally, I feel like he's a really good option. And this is my little sales pitch, my unpaid, not sponsoring sales pitch, is that essentially he has the credentials, he has the experience, and he has the respect and compassion and active involvement in the transgender community to really be a comprehensive healthcare surgeon and doctor, whatever term I'm supposed to use. But yeah, so I really encourage anybody, like, to research him. I guess, oh, sorry, my phone is so shaky. Like, for people, if they wanted to see a bit more results, I obviously do post more, but this is better up. So this is what my results with him looks like 6 months post top surgery. So yeah, like, I definitely feel like he did really good on keeping the scar line small and minimal and all of that. I'm really happy with the nipple placement and everything, and I have full sensation in my chest. Like, some people have dead zones, and this obviously, it varies per person. It's not just because he's a great surgeon. Like, you could have an amazing surgeon and still you might not have the same sensation before and after. But for me, like, I was really worried that I was gonna like lose certain sensation, but there is like full chest feeling. I don't have like any pain. I sometimes have like little random like nerve pains and all of that. But other than that, like, it's really healing well, and I've had like no complications so far. And yeah, and I know this video has been a little rambly, and if I had more motivation, maybe I would edit it, but I don't, so here we are. But yeah, so that is my personal testimony for him, and if anyone has more questions, obviously comment or just DM me or email or whatever people do, and let me know like specific stuff. I'm gonna post another video hopefully soon about my experience with New Jersey Medicaid and getting the surgery approved, because that was a friggin' nightmare, but it is possible. So I definitely want to be able to give my perspective on that to help anyone out who's doing that. But other than that, like, good luck. If any of you guys choose to pursue him after seeing this, like, let me know how it goes, because like, yeah, I'm just ending it now because I'm going to keep on rambling. So thank you for watching. Check Dr. Keith out. Links are going to be in the description. Bye.